This is a really cutting edge treatment that so many people can benefit from because it's only 3 to 6 hours on average that people need to see kind of a alleviation of symptoms.
I am here today with two psychotherapists at our office at DiRito Psychology, Dr. DiRito and Jenny Lehman. And we're going to talk a little bit about trauma today and some new training that you guys have participated in.
It's called RTM. It's the reconsolidation of traumatic memories. And it focuses on re-imaging the memory of the person that's had the trauma and allowing them to have a different response to the trauma in the future.
So tell me what trauma is.
Trauma can be anything, and I think sometimes what we think of trauma is just the person that's been off to war and has seen explosions or experienced death, but trauma can actually also be the lack of something happening. For instance, growing up without a parent or without nurturing from a parent. So if you have a question of whether you've experienced trauma, we can do a screening to see that. So if you think, I don't know if it's trauma, come on in and let us give you the screening.
So let's talk about some specific symptoms of post-traumatic stress disorder that maybe people should be on alert about, no pun intended.
Primarily what I've seen in practice and just, what you see when you're diagnosing someone is flashbacks, which are just kind of the reliving of the event. So it's almost like you feel like you're in that space and time, having that kind of same neurological response in your body, increased heart rate, sweating, maybe feel a little dizzy, maybe a little nauseous. So those kind of responses. Nightmares. We see nightmares quite a bit. Perhaps just kind of having unexpected responses at different times to different things in the environment, stimulating the environment.
Sometimes I hear people talking about feeling this dream-like, floaty feeling. They almost feel as if they're outside of their body and looking at themselves down in a situation, what we would call disassociation. Feeling as if it's unreal what they're experiencing.
Do you guys find that people often avoid getting treatment for trauma?
Absolutely, because it's really painful to relive those experiences, and particularly to kind of feel that neurological arousal that one feels when they've got post-traumatic stress. So naturally people don't want to experience that. The great thing about RTM is that as soon as we see someone starting to re-experience, we're distracting them away from that to something else, because the whole goal is to recode that memory so that they don't have that trauma experience again.
So it becomes more of a historical memory, right? Rather than something that's eliciting so much anxiety or a physiological response.
Sure, you'll still have the memory. We're not going to get rid of the memory for you. You'll still be able to talk about it. You might even have some emotions associated with it, but it's not going to be debilitating.
It sounds like the most amazing tool in your toolbox for trauma. So we want to challenge people in 22 to be bold and stop avoiding what they've been avoiding, and get through whatever bad stuff has happened to them, and resolve it. And they should come and see you guys, because this is time limited. It takes 3 or 4 sessions, and they're going to get their life back.